Endometriosis. Just what is endometriosis? It seems like more people have it than not. 1 out of 10 people are affected by endometriosis. So just what is it? Endometriosis, if we're going to just break this down for you, is when the lining of your uterus, also known as the endometrium, gets shot out through the fallopian tubes and implants on various aspects of your pelvis. That can be on the ovaries, it can be in the cul-de-sac, it can be on the intestines. Endometriosis can basically implant just about everywhere. Now, normally what should happen with the lining of the uterus or the endometrium is that every month it should be shed, through the cervix, out the vagina as your period. But again, with endometriosis, some of this lining or implants get shot out through the fallopian tubes and it implants on various aspects of, again, the pelvis, abdomen, the bowels, etc. So how do you know if you have endometriosis or not? You can be affected and have any number of symptoms. The hallmark finding with endometriosis is cyclical painful periods. Every month your period is really painful, and the pain usually isn't, relieved much with things like non-steroidals. Those are going to be things like Motrin, ibuprofen, Aleve, the non-steroidal of your choice. Heating pads usually don't help. Again, painful periods that you're getting once a month. Endometriosis can also be characterized by, painful sex, bowel or bladder issues, abdominal pain, pain with intercourse, pain with urination, irregular bleeding, heavy periods. The thing with endometriosis is most women are just, you get so accustomed to being uncomfortable, whether it's during sex or whether it's during your periods, that you think it's the norm, that it's par for the course, and in actuality, it's not. So if you're someone that thinks that, everything that Dr. Angela just said, maybe that applies to me, I really think you should have an honest conversation with your GYN to see if perhaps this is something that affects you. Because I think that I mentioned, 1 out of 10 women are affected by this. Roughly 176 million women worldwide have endometriosis. So what do we do to kind of treat the symptoms or to treat this? There are a lot of different options. If non-steroidals aren't working, again, Aleve, ibuprofen, Motrin, etc., the next tier is typically hormonal, something that's going to help quiet the ovaries, because endometriosis is stimulated via hormones. It's responsive to things like estrogen and progesterone. So a lot of times what we do is we put people on like a birth control pill to kind of help, decrease or quiet ovaries, as well as decrease, the length and I guess the timing of occurrence of periods. If we can give you less periods or periods that last not as long, then that certainly will help in treating. So, hormonal options for endometriosis might include low-dose birth control pills, Depo-Provera, sometimes Depo-Lupron, NuvaRing. Again, anything that's hormonal that will help to quiet the uterus. Last but not least, surgical management of endometriosis. This kind of is a last resort when other things aren't working, i.e. previously mentioned things are not working. Usually treatment for endometriosis, if it's a surgical approach, involves, laparoscopic procedures. That's minimally invasive. We go in through the umbilicus or the belly button with the camera and we look around, and usually we can see endometriosis. You can't see all endometriosis, but usually you can see endometriosis. Surgically speaking, what we try to do once we do end up, doing a laparoscopic procedure or surgery, is we visualize the endometriosis and we try to remove as much of it as possible. Occasionally we'll see things like an endometrioma, which is a cyst that is commonly seen with endometriosis. I actually just recently removed one. It was 7 centimeters. And these are also called chocolate cysts because the inside of them are filled with chocolate syrup-like material. It's not really chocolate syrup, but that's the appearance that it gives. So surgically speaking, we usually try to remove as many signs of endometriosis as possible, whether that's removing endometriomas or various implants that we see throughout the pelvis. And then, an extreme measure for treating endometriosis would be a full-out hysterectomy. But again, depending on the age, reproductive status of the patient, there are a lot of things that go into consideration prior to taking that extreme measure. So again, if you are someone that has cyclical painful periods, irregular bleeding, heavy periods, bowel or bladder issues around the time of your period, painful intercourse, and it's interfering with your quality of life, I think that certainly a visit with your OBGYN is worthwhile to see if perhaps this is something that is affecting you. Thanks for tuning in. Don't forget to ask Dr. Angela, giving you the answers. Thank you.